Central nervous system anomalies detected in first trimester. Let's comment the anomalies that can be detected in first trimester. It is known that the embryonic development and the fetal development in the first weeks of pregnancy have particular details that will be different from the brain at term. This doesn't happen with the heart. The heart at 14 weeks is completely formed. Instead, the brain will continue its development even after birth. A brain at 12 weeks is completely different than a brain at 24 weeks or at 30 weeks. What is considered normal in the assessment of central nervous system? At 11-14 weeks, we have to see the integrity of the skull, the interhemispheric fissure, the choroid plexus occupying the entire lateral ventricles, and thin cortex and the insula. Regarding the posterior fossa, we can identify the cerebellum hemispheres. If it has more than 11 weeks, the thalamus. If it is of more than 13 weeks, third ventricle can be visible depending on the weeks of gestation. And what is considered a late appearance in first trimester is cavum septum pellucidum, corpus callosum, cerebellum vermis, or the sulci. Usually are not seen in first trimester ultrasound. This is a dynamic assessment at 14 weeks. Midline, choroid plexus, we could even see the third ventricles, the symmetry of the hemispheres, and we can also see the posterior fossa with the cerebellum. This will be a normal evaluation at 14 weeks. In a sagittal section, we have to learn to see the brainstem and the fourth ventricle and cisterna magna. It is also important to evaluate the vertebral column. The ossification of the spine is done from 11 weeks on. A good alignment with no scoliosis, the integrity of the skin, and a late appearance, the vertebral bodies, from 16 weeks, so it is normal if we do not see it till that time. Which pathology is detectable in first trimester? In 1987, different pathologies were described as detectable in first trimester. In that moment, the ultrasound was performed at 10 to 14 weeks, and from this study, they stated that it was advisable to postpone the ultrasound 1 week later, from 10 to 11 weeks, because there were cases of acrania that were not diagnosed at 10 but at 11 weeks. This is a list of pathology by frequency. As you can see, the most frequent one is the anencephaly, exencephaly, and acrania, which constitute half of the cases, then the holoprosencephaly, and then the others. A recent review in 2016 commented the same pathology mentioned before, but in this decade the screening ultrasound is performed from 11 weeks, due to the cases of acrania non-diagnosable at 10 weeks. This will be the first group of pathologies that should be rolled out in first trimester. Let us start with the sequence anencephaly, exencephaly, acrania. It's relatively frequent, affects 1 in 1,000 pregnancies, is diagnosed from 11 weeks. At first, there is a skull absence with intact meninges. This can simulate a normal head. Secondarily, there is destruction of these meninges, and then there is a cerebral destruction. 15% of cases are associated with other anomalies. There is also association to chromosomal anomalies, and is a lethal pathology in 100% of cases. The measurement is more difficult to assess, but if we perform it when there is only acrania with intact meninges, it can be done, so the CRL doesn't change. This has been proven. If the measurement is in an early stage, the CRL will be useful to date the gestation. But if the measurement is done in a later stage, we will have lower CRLs. This is an example of acrania in which the meninges are intact. The morphology of the head is relatively normal, but there is lack of ossification. Careful! if it is an early measurement, CRLs before 45 millimeters in less than 11 weeks, we cannot ensure there is a lack of cranium. This is a pregnancy of 10 weeks, so we cannot be sure there is no skull. We should wait 1 week more. This is an advanced case. This is a brain with irregular shape. We see the exencephaly. The meninges are distracted, so the content of the brain is outside the cavity of the meninges. This is other example, exencephaly, in which we see the same situation, in which it seems the fetus has like a hat in the head. The brain is outside the meninges, the typical sign of the Mickey Mouse with enlarged eyes. And this will be an even more advanced stage, in which there is no brain. Sometimes we can see the remains of the brain tissue. This is a typical progression of these cases. Here, the same, the face, the orbits, and almost no brain, with little remains. The second pathology that must be ruled out is the holoprosencephaly. It's more infrequent, 1 in 2,000 pregnancies. There are several types. The severe, which will be the fusion of ventricle, thalamus, absent cavum septum pellucidum, absent or dysgenetic corpus callosum. This is the one that could be identifiable in first trimester. More than 50% of cases are associated to severe chromosomal anomaly, typically 13 trisomy, and there is 100% of poor prognosis. Poor prognosis in neurodevelopment. Here we can see the example of different types. The most severe, the allobar holoprosencephaly, is the one seen in first trimester. And then we have the semilobar or lobar. Can be difficult to see and depends on the resolution of the ultrasound. So sometimes are evident in second trimester and not in the first one. This is an example of a 13 weeks allobar holoprosencephaly with fusion ventricles, with fusion thalamus. This is other example, vaginal ultrasound, in a case of holoprosencephaly, a single ventricle cavity with midline, the midline disappears, and fusion thalamus. The spina bifida is the third pathology that must be ruled out. This is a coronal section at 13 weeks in which we can see the skin defect. This is another example, the bone and skin defect. Here in a sagittal section, we see that the structure of the back is lost. In some cases, we can see the lemon and banana sign, the cerebellum in the posterior parts in a banana form. Here we can see it again. The lemon sign is usually not seen in first trimester. Not far ago, Tawi and Nicolaides described a new marker that could be helpful in detecting spina bifida in first trimester. It was based in the collapse of the fourth ventricle due to this malformation. This will be in a sagittal view, that is the one used for measuring the NT, in which we are also seeing the fourth ventricle, the thalamus, and the brainstem. As you can see, if there is a spina bifida, we will see a marked malformation of the brainstem and also the frontomaxillary facial angle. This will be an example of the intracranial translucency, which coincides with the fourth ventricle. But we have to know that it's a marker that is not easy to measure. In the article published by Taoui and Nicolaides of the fourth neural tube defect, they found this intranuchal translucency in the fourth of them. But when in Toronto they tried to replicate this study a few years ago, after what they observed, Only half of them had the association. Sensibility was in 4 of 8 cases. Further studies have demonstrated that this marker doesn't have much utility regarding the identification of spina bifida. Therefore, its clinical applicability is questioned. It's a section that is difficult to obtain, and there is no agreement between operators. What has logic is that the 3 spaces will be reduced: the cisterna magna, the intracranial translucency, and the brainstem. Is similar to Arnold-Chiari, but in first trimester. The increased brainstem and reduced posterior fossa. This will be the section to see the brainstem, the 4th ventricle, the cisterna magna, and the nuchal translucency. And here we see a reduced 4th ventricle and posterior fossa. Then it will make us think in spina bifida, but it hasn't been established as a marker yet, due to the difficulties in its exploration. Finally, there is other group of malformative diseases that can be diagnosed in first trimester, but less frequent. There are some examples. This is a fetus with an encephalocele. There is a defect in the cranium and exteriorization of encephalic tissue in the occipital part. This is another example, with protrusion of a lot of tissue, a greater encephalocele, with ventricular dilation. Other encephalocele, in which there is cerebellar herniation through the encephalocele. This is an iniencephaly. This is an open defect in the cervical column. This is a spina bifida with a defect at the occipital and cervical level. The fetus is in an hyperextended position. It's a diagnosis that can be done with reliability. It's a severe pathology. This is another case of iniencephaly. The fetus persists in this hyperextended position, and also the fetus has an open defect at the cervical level. We cannot see in this ultrasound because the position of the fetus makes it difficult to see. In some cases we see severe ventriculomegalias, which are pathological, as is the case with great dilation of ventricles, posterior fossa dilation. This is a Dandy-Walker suspicion when seeing a cisterna magna dilation. And be careful at 15-16 weeks because the vermis is not well seen. At this gestational age, it is possible to see a dilation of the cisterna magna without being pathological. But we could think it's a dilation of the posterior fossa with communication with the 4th ventricle. And we could think it's a Dandy-Walker malformation, when in reality it is normal. It is normal development for that gestational age. It's the normal development of the cerebellar vermis for that time. As conclusions, regarding the anomalies that must be ruled out at 11-14 weeks, the most frequent ones are the acrania, exencephaly, and encephaly, corresponds to more than half of the cases. A lobar holoprosencephaly can be diagnosed at this gestational age. It's very important most of the time is associated with 13 trisomy. Encephalocele and iniencephaly, which are severe. The encephalocele due to the quantity of brain tissue herniated, and the iniencephaly due to the hyperextended position that acquires the fetus. Spina bifida is more difficult to diagnose. Generally, we prefer to look at the defect at the vertebral column or look for the lemon and banana sign rather than to look for the intracranial translucency, because are difficult to assess. Regarding ventriculomegaly or cerebellar vermis anomaly, severe cases can be suspected. And finally, corpus callosum anomalies or cortical anomalies are never detected at this gestational age because are incompletely formed.